Hello and welcome. Thank you for attending today's VI Aesthetics seminar regarding the VI Peel portfolio and the VI Derm skincare line. If you have any questions during the presentation, please feel free to put your questions into the Q&A or chat box on the right-hand side of your screen. We'll go ahead and get started. At VI Aesthetics, we believe that education, along with the proper application, is a key to successful and safe treatments in your practice. VI Aesthetics was founded over 12 years ago in 2005 by Dr. Abdallah Khalil, and he was looking to find a non-invasive, innovative, and forward-thinking way to treating skin and helping people rejuvenate and transform their skin to have confidence for long-term health in their skin. In doing so, he created the first painless chemical peel, the VI Peel, and has gone on to create a full portfolio of peels to address anti-aging, pigmentation, acne, and scarring concerns in the skin. He also created the VI Derm skincare line, which is a complementary portfolio of skincare items intended to extend and enhance the results of your peels, but also can be used daily just to optimize overall skin health. The chemical peel market is a growing market in the aesthetic field. You can see some data here from the ASPS, the American Society of Plastic Surgeons, showing chemical peels as the third most common non-surgical procedure. Over 1,300,000 chemical peels have been performed by doctors and physician extenders in 2016. You also have some data here from the ASDS showing that for consumers' choices, considering cosmetic procedures, the consumers have chemical peels rated as number 4 as their top procedures. So in top 5, we have chemical peels playing a large role in the marketplace. They also show here some information regarding consumers' choices for what they're trying to address in their skin, some concerns including skin texture and discoloration, periorbital wrinkles as well as perioral wrinkles, as well as acne scarring. The VI Peel portfolio can actually address all of these top concerns. Various factors impact the skin over time, including sun damage and stress, pollution, background and heritage, medications, skin conditions that people may have, pollution and cosmetics can also affect the skin, as well as hormonal changes, muscle movement, diet and environment, and pre- and post-pregnancies. So all these factors that impact the skin result in time with loss of collagen, fine lines and wrinkles, pigmentation irregularities, skin roughness, acne scarring, and loss of elasticity in the skin. With all of these factors that result in various issues within the skin, the VI Peel portfolio can address fine lines, wrinkles, pore size, tone, texture, clarity, scarring in the skin, pigmentation damage, active acne or acne-prone skin can be addressed, as well as acne scarring in the skin, and just basically for the overall health and rejuvenation of your skin. We'll have a quick review here of the skin. You can see here that the VI peels are self-neutralizing, non-invasive, light to medium depth peels, and that's depending on the application technique and the pressure that is used by the practitioner when applying the solution. You also see here that the VI peels are controlled to the papillary level of the dermis. So it's going to go down and have those rejuvenation that can happen in the skin at that papillary level of the dermis, as well as transformative changes. But it's not going to go down into the reticular or subcutaneous fatty tissue layers of the skin where long-term damage can happen. So we're actually going to just penetrate through that epidermis and through the stratum corneum and such and go down to that papillary level of the dermis. It will self-neutralize at that layer due to the fact that they are low-level acids. It will self-neutralize on its own. There is no need to neutralize the solution once placed on the skin. People often ask why they should choose the VI Peel. There's various reasons to choose the VI Peel. It's suitable for a variety of skin types and conditions, can be used safely on various Fitzpatrick types as well. Also, you can obtain excellent results without the serious side effects of a deep peel. You'll have longer lasting results than any superficial peels, and it'll be virtually painless after the first pass on the skin with minimal downtime. It's also very predictable, the results of the VI Peel, and it's also self-neutralizing, which we mentioned. It's controlled to that papillary level of the dermis, so it won't reach any lower levels where it could cause long-term damage, and it'll have great significant regenerative changes at that papillary level. It also is performed in a single session. No prep is necessary. Some doctors do choose to prep their patients if it's a pigmentation issue, but typically there is no prep necessary, and you'll have visible results in as little as 7 days. Also with the VI Peel system, you'll get to have each patient go home with a post-peel take-home kit. This is an added value for your patient, and it has VI Derm Cleanser included, as well as our SPF 50 sunscreen, post-peel protectant, and towelettes. The towelettes are to reinvigorate within the first 48 hours and prepare the skin for peeling. The other great thing about the VI Peel is that it's an introduction with that post-peel kit to our VI Derm skincare line. So if you're introducing them with a post-peel kit to the cleanser and the SPF 50, you'll have a customer coming in that will most likely be interested in finding out more about the VI Derm skincare line and what it can do for their skin. The availability of our VI Peel portfolios are never sold directly to consumers through any channel, and we have a strict policy here at VI Aesthetics to make sure that that does not happen. We also have the fact that we are only done by licensed professionals and can be only administered by licensed professionals, including doctors, NPs, RNs, and PAs, and estheticians can also do the application, but they have to work underneath a medical director. It's also important that that training is properly completed. So you have a local rep that can come out and do your initial training, or if you have any new staff members that are in need of training, they can come out and do that for you. And then we'll move along here. To talk about the various peels within the portfolio. We have 5 peels within our peel portfolio. We have the VI Peel. We have our VI Peel Precision. We have the VI Peel Precision Plus. We have the VI Peel Purify and the VI Peel Purify Precision Plus. The VI Peel and the VI Peel Precision are anti-aging peels. The VI Peel Precision Plus is our pigmentation peel. And then we have 2 acne peels, the VI Peel Purify and then the VI Peel Purify Precision Plus. We'll discuss each of them now. The VI Peel is our anti-aging peel. This is the original formula that was specifically formulated to rejuvenate skin and help prevent future damage in the skin. It can soften lines and wrinkles, help restore a more even skin tone, and work on the texture and clarity as well. It also will work on the overall appearance of the tone of skin. There are 5 main ingredients in all of our peel solutions: TCA, phenol, salicylic acid, retinoic acid, and a vitamin C mineral blend. These 5 ingredients synergistically work together to go in and help with that rejuvenation in the skin. Here's an example of someone who has 3 VI peels over a 3-month period of time, and you can note the difference and change in her under eye area with the fine lines and wrinkles, as well as the overall tone and texture of her skin. We also have an example here where you can see a woman who had 3 peels over a 4-month period of time, and she has a bit of a darker skin tone, a darker complexion, and we were able, with just the regular VI Peel solution, to help remove some of that UV damage that was in her cheek area, as well as some scarring and PIH that was in her cheek area, and then the overall tone and the rejuvenation of her skin is definitely notable in this photo. Now we'll move on to the VI Peel Precision. This one is used for anti-aging as well, but it's definitely for more mature skin types or anyone who has an impacted stratum corneum that you're trying to press and use that solution to go and penetrate through. It also works really well on body parts, and the reason for that is this comes with a 5 milliliter solution of the TCA phenol salicylic retinoic acid with that vitamin C mineral blend, but it also comes with a 1 ml booster, and that booster is the same 5 main ingredients, but it's going to give you more volume and penetration for the skin, so therefore you can penetrate through more mature skin types or body parts, and that will give you just a couple extra passes on the skin so that you know that you're going to get the best peel possible for someone that may have thicker skin that's harder to penetrate through. Here's an example of a woman that did 2 VI Precision peels, and then we followed it up with 2 Precision Plus peels within a 5-month period of time. That's the other great thing about the VI Peel portfolio is they are interchangeable. You don't always have to keep one person on the exact same peel, as skin does change, and we're able to rid the skin of certain types of conditions and then address other issues within the skin. So you definitely can change the peels and interchange them when you're moving from peel to peel, especially within working in a series. So that's an example of that for you. And then here's an example of body peeling. You can note her chest area. The overall tone and texture has changed. We were able to actually reverse some of the sun damage and help lift that from the skin with doing 2 VI Precision peels. Now we'll talk about the Precision Plus peel. And the Precision Plus peel is actually designed for anyone who has uneven skin tone or pigment and scarring concerns in the body or the face. This will work to brighten the skin and overall look a lighter tone, to kind of rejuvenate the skin and bring it back to its original tone, but it'll also work on age spots, sunspots, melasma, stubborn areas of pigmentation that are in the skin, and also work on the overall tone and texture. This has the 5 ml vial that has our main ingredients of TCA, phenol, salicylic, retinoic, and that vitamin C mineral blend. But it also has a new dual booster system. And this new dual booster system will be 2 ampules that you will add into that 5 ml solution. And one is the Lighten booster that will have hydroquinone, kojic acid, TCA, retinoic acid, and vitamin C. And then the Brighten booster has salicylic acid that will help go in and brighten and lighten and give added volume and penetration so that we can actually penetrate down into that papillary level and have those regenerative changes. Here are some examples of the VI Precision Plus peel. This was over 3 months. This person had 3, and you can note the change in her overall tone and texture, but also the ability to remove the UV damage, pigment damage, and scarring that was in her skin. She had beautiful results, really extraordinary results in changing her life for sure. And then here we have a woman that had 4 VI Precision Plus peels over a 7-month period of time. She suffered from pigmentation damage long term. And you can note in her cheek area the ability that we had to restore her skin to its natural tone and remove age spots and lentogens, as well as pigmentation damage, and also work on fine lines and wrinkles, tone, texture, clarity, all at the same time. She had really beautiful results. And here's the last one in the Precision Plus peel. This is a man who had a lot of topical sun damage after 1 season of being exposed in the summer. So he came in, and after just 1 Precision Plus peel, we were able to remove a lot of that topical sun damage that he had and restore his skin to a more even tone overall, as well as help remove a lot of those sunspots and sun damage that he had received from UV rays over the summer. Beautiful results there also. Now we'll move on to our acne peels. The first one we'll go into is the VI Peel Purify. This one's for acne-prone skin and active acne within the skin. This will exfoliate and help clear out the skin and comedones, but it'll also kill P. acne bacteria and help with redness and inflammation. And the Purify solution is a bit different from the original VI solution, but it does have those same 5 main ingredients, the TCA, phenol, salicylic, retinoic acid, vitamin C mineral blend. But this formulation adds into it the BPO, kojic acid, and hydrocortisone. That BPO is going to be what goes into and kills the P. acne bacteria. The kojic acid really helps to unclog pores and help with exfoliation. And then that hydrocortisone is built into this formulation because that's going to go in and help with inflammation and redness. And as we know, people that suffer from acne issues within their skin always have redness and inflammation from those breakouts and from that oil and bacteria that's built up underneath. So that hydrocortisone will help with that inflammation and calm it. Here's an example of a young gentleman who had 3 Purify pills over a 3-month period of time. You can note the change in the active acne in his skin. The redness and inflammation has decreased, and overall the tone and texture of his skin is just much brighter and more even. And then here we'll move on and talk about the last peel within the portfolio, and this is the VI Peel Purify with Precision Plus. This is for anyone who has active acne and acne scarring in the skin. This works fantastic because it not only goes in with that Purify solution that has the phenol, salicylic, retinoic acid, vitamin C, TCA, and mineral blend, but it also has that BPO, kojic, and hydrocortisone in it. And then this also gets added in that new Precision Plus dual booster system. And that will have that Lighten booster that has the hydroquinone, kojic acid, TCA, and retinoic acid with vitamin C. And then the Brighten booster as well that has the salicylic acid in it that will help to lighten and add more volume for penetration. I kind of think of the Purify with Precision Plus as a 2-in-1 peel because you're able to address the active acne in the skin as well as the scarring to help lighten that damage at the same time. Typically, people have to do separate complementary procedures to do this, but we're able to address both of these at once within the Purify Precision Plus peel. It's a fantastic peel with wonderful results, as you can see here. This woman had 4 Precision Plus peels over a 4-month period of time. It really helped to remove the damage within the skin that was left behind from older acne scarring, as well as give her an even tone within her skin and remove any active acne in the skin. Here we have a close-up of the same woman, so you can take note to her forehead area. A lot of people get enlarged pores when they're suffering from oily or acneic skin, and with a series of 4 VI Purify Precision Plus peels over a 4-month period of time, we were able to minimize the pore size in her forehead area. So up close, so you can really, really take note to the ability the peel solution had to go in, penetrate the skin, and help shrink those pores. Here we'll talk about the proper skin analysis, and I think this is very important for practitioners as they're doing a consult with a patient to take some factors into account regarding what peel would be best for that patient. And those factors can include the type of skin someone has. What's their skin quality? Do they have dry, sensitive skin, or do they have oily skin? What are the hydration levels like in their skin? What are their skin conditions? If it's mostly a tone, texture, fine lines issue, I would highly suggest starting them with a regular VI peel and then see how their skin reacts. If they have a thicker skin that's more mature, you may actually want to go straight to using the Precision peel. But if it's an acne issue, you'll go straight to one of our Purify peels, and any pigmentation damage, you automatically would take them straight to the Precision Plus peel as long as they didn't have any contraindications. Another factor that I think is important to take note is the skin tone. Anyone who has a higher Fitzpatrick type, they have a higher risk of PIH within the skin. So you always want to try and speak with them about possibly avoiding exercise the entire peeling process, that is 7 days, so that they don't induce any heat that could lead to PIH in the skin. And then chat with them about, do they typically get PIH that pops up after they have a small breakout or they get a little cut in their skin, because that'll give you a good range to figure out whether or not you think their skin will have a reaction, and they should refrain from exercising during the peeling process. And it'll also let you know not to be as aggressive with application, because if you're too aggressive, it can bring more heat up in the skin, which could lead to PIH. Then you'll look at the patient and decide what the current damage is that's in their skin. Is it mostly age spots and sunspots with pigment issues? Then you definitely would go straight to the Precision Plus peel. Is it a scarring issue? The Precision Plus peel also works fantastic for that. If someone had active acne with that damage in their skin, then you would know to go over to the Purify peel. But if they had active acne and scarring and damage, then you would know to use the Purify Precision Plus. And then last but not least, I think 2 other things that are important during the skin analysis is to definitely chat with the patient about what their skin concerns are, what concerns them. And then always think about the fact that what we notice as practitioners may not be what they notice, and they feel that they need improvement. So we definitely want to address the patient's concerns and then chat with them about what their desired outcome and what their expectations are to make sure that we're choosing the proper peel to meet those expectations. And people often ask us, how often can a VI peel actually be done? Safely, the VI peel portfolio can be done every 4 to 6 weeks in a series based on the needs of the skin. And that means if you're doing a series of 3 or 4, it's safe to have someone come in every 4 to 6 weeks. For more sensitive types of skin, I would definitely push it to that 6-week mark. But if you know someone is comfortable with the peeling process, it is safe to do every 4 weeks, because that's the cell turnover rate in skin. And then for the health of skin, you can definitely suggest that they do these quarterly for maintenance purposes or seasonally. And then now we'll go ahead and talk about the contraindications within the VI peel portfolio. There are contraindications that I think are very important to go over every single time. Even if someone is doing a series and coming in every 4 weeks, it's very important to review this to make sure that their health hasn't changed, because health can change in the matter of a day. So here are the contraindications for the VI peel portfolio. Pregnancy and breastfeeding, anyone who's undergone chemotherapy or radiation within a 6-month period of time, anyone who's used Accutane or isotretinoin within a 6-month period of time, anyone who has autoimmune disorders. You always want to check with their physician, and it's at the physician's discretion whether they have a strong enough immunity to process the chemicals within the peel solution. Anyone who has an aspirin allergy, and that is due to the fact that we have salicylic acid within our formulation. Anyone who has a phenol or hydroquinone allergy. Phenol is in all of our peel solutions. The hydroquinone is actually only in the Precision Plus and the Purify Precision Plus. But I do think it's important to note that, so that if you find out someone does have a hydroquinone allergy, you would mark that on their charts. for your office, so that if it was you or another practitioner that went in to do a peel later down the road, you would definitely know not to choose one that actually has hydroquinone in it if they do have an allergy. Anyone who has active cold sores or a history of herpes simplex. Active cold sores, you would never want to peel someone with an active cold sore. You would ask them to reschedule their appointment, as it could actually spread onto the skin from where the active cold sore is around the perioral area, and then it could actually spread all over the face, and it's a very painful and unpleasant process for the patient to heal from. If they have a history of herpes simplex, they definitely can receive the peel, but it's suggested that they would take the medication their doctor prescribes to them for when they receive a cold sore outbreak, and that they would use that for the first 3 to 4 days during the skin's peeling process to make sure that they don't have an outbreak and to help prevent any outbreaks. Anyone with inflamed skin or open wounds is not suggested, especially inflamed skin that may have just been healing from a scar. You definitely want to wait until there's no inflammation, redness, because you don't want to aggravate that area. Also, anyone who has a liver condition, and that's due to the fact that we do process chemicals through the body. So you want to make sure if they have a liver condition, you check with their physician first as to whether or not they are strong enough to process those chemicals through their liver. And then last but not least, anything that weakens a patient's immunity. You definitely want to check with them about their immunity and see if there's anything that would weaken their immunity that would cause them to have issues with the peeling process. Now we'll quickly go through the VI Peel consent form. Again, this should be filled out every single time that you have a patient come in, and it should be initialed all the way down the side by the patient, and then signed and dated by the patient, and signed and dated by you, the practitioner, as well as noting the lot number, the type of peel, and the expiration date, so that you have that on their chart for you to note. So for the consent form, prior to receiving the treatment, you communicate with the practitioner about any conditions or medications that may contraindicate the procedure. They understand that there will be a degree of discomfort, such as burning, stinging, redness, heat, and tightness in the skin, and during a week after that procedure. They understand there's no guarantee of final results of the peel, and occasionally hyperpigmentation may develop and persist for a week or months after a peel. And that typically happens when people are pulling back on the skin that is actually shedding. And we try to ask that they not do that. They can use a small cuticle scissor to cut away. They can go cleanse the skin, and that will help move the peeling along. Or they can actually use the creams provided in the post-peel kit, whether it be the post-peel protectant or SPF 50, and that can help with any skin that may be hanging. They never want to pull back because it's going to allow oxygen to hit the skin, and that could lead to PIH within the skin. They understand that there's no guarantee of final results of the peel. They understand that complications are rare, but they do occur at times. In the event of any complication, they will contact the physician, clinician, practitioner who performed the treatment. They understand that if they have any acne condition in the skin, if the peel will bring oils and bacteria from below the surface, and it can actually induce a breakout. And if it does this, it is positive, and we'll talk a little bit more about that later. They understand the maintenance of the peel treatments are necessary to maintain results, as well as the recommended VI Derm skincare regimen, including SPF 50+. They know that they cannot have extended direct sun exposure, including tanning beds, that are strictly prohibited before and after receiving the VI peel. They understand no activities involving excessive sweating can be done for 72 to 96 hours. That's exercising, saunas, hot tubs, steam rooms, cooking over hot stoves, taking hot baths. You just don't want to induce any sweating in the skin because that could lead to blistering. They understand also that they must protect the skin with the VI Derm SPF 50+ and avoid sun exposure for that full 7-day exfoliation process, that they're having an elective cosmetic procedure done, and last but not least, that no other chemical peels, no facial machine brushes such as Clarisonic, or any medical device treatments, including lasers, IPLs, etc., should be performed on someone's skin until the physician-clinician releases them to do so. So again, very important every time this consent form is filled out and signed by not only the patient, but the practitioner as well. And now we'll move into the peel application. So once you've done your skin analysis, then you've gone through the consent form, they've signed everything, now we're going to move into applying the peel. The first step will be to prep that patient by cleansing with the VI Derm cleanser. We do have 8 ounces of our VI Derm cleanser available, but for your back bars as practitioners, you also may want to get a 24-ounce bottle for your back bar. It's a beautiful way to cleanse the skin, and I always suggest cleansing the skin, and then if someone does come in that may have makeup on of any type, I always double cleanse the skin first, just to make sure we've removed everything from that top layer of skin so the peel solution will penetrate down deeply into the skin. Then I always suggest taking before photos so that you can track that progress. of the skin during the treatments, and then the after photos for comparison purposes to really see how you're really transforming someone's skin, especially when you're doing a series. Then you'll degrease the skin with a prep towelette that's provided. And you'll degrease twice if the patient has acne skin, has oily skin, or if you're peeling body parts. If you're degreasing twice, I always suggest getting a 100% acetone bottle for your back bar so that you have it there ready to go. And you would just use the prep towelette first and then go in with a little bit of that 100% acetone and degrease that second time. Then you'll always open that vial carefully because they do have the tendency to pop at times. You'll point it away from yourself and from the patient always, and then pour that solution from that 5 milliliters into the cuppy that comes provided as well. Then if you're using any of our boosters, that's when you would add them as well if applicable. And then you're going to use the gauze that's provided in our kits as well and begin the passes on the face. That gauze was specifically chosen because it's loosely woven, so it has the ability to have an abrasion on the skin. You don't need to be rough when applying the solution, and we'll talk a little bit about that as well in a couple of minutes. But you definitely want to work methodically over the face to make sure the solution is equally distributed onto the skin and use all the solution that's provided. These vials are intended for full use. You don't want to ever split vials or separate boosters out. It's intended to be used as the manufacturer provides it. And then I always say to work in quadrants of the face, and here's just an example of that. I typically like to peel the outer edge of the face with the solution first and apply that because that's going to give me a good ability to see how the skin is reacting. Is it frosting right away? Is it getting red right away? So I'll go around the edge of the skin, around the jawline and the forehead area, and then I go fill in the quadrants. The forehead first, then I move down into the cheek areas, and then have your patient tuck their lip in, and then you can move properly around the perioral area and the nose area as well. And then you'll first pass, you'll do a light application, and then you can be a little bit heavier with your pressure on the second, third, and fourth pass so that the peel solution will really penetrate down into those skin layers. On the last pass of solution that you'll put on the skin, you'll always want to ask the patient if they'd like their under eye area done as well, and then you'll have them open their eyes and look up and then do a very light swipe in the under eye area just once on that last pass. You never want to do multiple passes in the under eye area as that's a very sensitive area of skin. So that light pass on the last pass will be sufficient enough for that under eye area. Here's some peeling tips for practitioners. Again, open that vial carefully, always with your thumb on that top stopper, and remove that silver wrapping and point it away from yourself and the patient. No more than 2 vials of any of our peel solutions can be applied to the skin within a 48-hour period, and that's due to toxicity levels. So 2 vials, and I always like to think of 1 vial as 2 hands of a surface space. So 2 hands can cover the face and the neck. 2 hands can also cover like half of a back or an arm. So always kind of think of that when you're trying to gauge as to how many vials you should be using to cover a specific area. If you're doing multiple peels within the same day, you always want to wear double gloves so that your hands don't dry out as a practitioner. Be lighter on the pressure with your first pass of the solution on the skin to allow that phenol, that numbing effect to kick in on the skin, and then you can proceed with heavier pressure on the second, third, and fourth pass. And apply that heavier, stronger pressure as well to troubled areas such as pigmentation issues, breakouts, fine lines. If you have too much aggression and you're going back and forth like an abrasive way, you actually may cause abrasions in the skin, and that can lead to PIH in the skin as well, which is not suggested. And then always apply that solution in the under eye area with a light pass of pressure on the last pass of applying the solution to the skin. And again, our peels are self-neutralizing, so you never want to neutralize our peel solution with any SPF, lotion, or makeup for 4 hours. If you're concerned about patients that are coming in summer months, because summer months are still okay to go ahead and peel as long as the person stays out of the sun, you definitely can ask them to bring a hat or a scarf to cover themselves as they leave your practice and go into their car. But for 4 hours, they really shouldn't be applying much to their skin at all. Now we'll talk about a bit of frosting. People often ask what frosting may look like. If you're not familiar, here's a couple examples. On the left-hand side, you'll see heavy frosting, and that's when you want to discontinue application. When heavy frosting occurs, avoid that area and then continue applying in the other areas that have not yet frosted. If you have something that looks like it does on the right-hand side, where it's a bit of crystallization, light frosting, or speckling, you can still continue to lightly apply to those areas. And be cautious, because as soon as you see that heavy frosting coming up on the skin, that's when you want to discontinue application in that area. The frosting, because of our peel self-neutralizes, it will diminish, so you don't need to neutralize it because they are low-level acids. And here's an example of the peeling process. This is the 7-day process. Day 1, the peel solution is applied to the skin. Day 2, the skin is tightening up. Day 3, the shedding begins within the skin. It starts in the perioral area and it starts to spread outward on the face. By day 4 and day 5, it's moved into the cheek and forehead area. By day 6, it's really on the edges of the face at that point, around the hairline, the jawline. And by day 7, the person is back to their regular skin where it's rejuvenated. We've removed some damage, and they're able at day 7 to then go back to their regular skincare regimen. If they're using active treatment products, I suggest waiting till about day 10 or day 14 to go back, because your skin will be very sensitive still on day 7, and you would definitely want your patients to focus on hydration around day 7, just to bring hydration back into the skin after we've peeled. Here's examples of light peeling within the VI Peel portfolio. You can see light shedding in the skin. And then if you note her forehead on that left photo, you can see that skin that's preparing to shed. It almost looks a little bit leathery, I always say, and a bit wrinkly. So that's actually what it looks like as it's preparing to peel. And then here's some examples of heavier shedding within the VI Peel portfolio. You can note it's just a bit more of a dense skin that's actually lifting. Now we'll talk about the patient post-peel take-home kit. This is for an added value for your patient. This will help them through that 7-day process. It comes with patient instructions, post-peel towelettes. 3 come in our regular kits. If you're getting the Precision Plus kits, that's the VI Precision Plus or the Purify Precision Plus. Those come with 2 extra towelettes that help combat pigmentation. And the instructions are written out on how to use the towelettes within this patient instruction guide. And then it also comes with cleansers and SPF 50 and our post-peel protectant that has active 1% hydrocortisone. With the towelettes that come within this post-peel kit, you'll use 1 towelette at the 4-hour mark. Night 1, you'll use 1 towelette or 2 towelettes if you're combating pigmentation issues. And then night 2 is when you'll actually use those final towelettes. And that's right before day 3 of the peeling is when the peeling starts. So that's right before the peeling will actually induce. You're going to use that last set. Also, I think it's important to note that after each darker green towelette, with anyone who has dark skin tones or pigmentation issues within the skin, you always want to apply a thin layer of our post-peel protectant that has active 1% hydrocortisone after those dark green towelettes. I say for them to wait about 10 minutes after applying the towelette, and then they're going to place that post-peel protectant on the skin. That'll help prevent PIH and help reduce inflammation. I also think it's important to go over the post-peel kit every time with a patient. This will help prevent them from having calls into your offices or any adverse issues happening during their peeling process, because you've prepared them and explained to them what to do on a daily basis during the peeling process. So here's some tips for practitioners. Reviewing that post-peel kit thoroughly to make sure we have the proper post-care. Make sure your patient's avoiding exercise for 3 to 4 days after receiving the peel, because you don't want any blistering or PIH. Explain the patient may not have heavy peeling, but it's still working on a cellular level. Some people say they don't have heavy peeling. It may be because they're typically getting aesthetic procedures every 4 to 6 weeks, or they're using active ingredients within their skincare regimen. But definitely it's still working on a cellular level as that solution has penetrated through the skin. If a patient's easily irritated, or if they have sensitive skin, the first night or the second night, they may experience a bit of itchiness in the skin, and if so, we can suggest taking a Benadryl, and that will help with itching and irritation. Also, anyone, again, with the darker skin tones, and I always say that's Fitzpatrick's 3 to 6, and any pigmented skin areas, make sure they always use the post-peel protectant 10 minutes after each dark green towelette. This will help prevent that PIH from coming up in the skin. Also, using that SPF 50 sunscreen during the 7-day peeling process as well as after is very important. I've had many people say, I used the sunscreen for 7 days, but then I ended up with new pigment. Well, that's because you need to continue using sunscreen on a daily basis to help protect the skin, especially after having a peel, because your skin is sensitive. Also, we can suggest the use of Aquaphor, coconut oil, or Curad Silver during the peeling process, and this helps with chapping, redness, and dryness in the skin. And then also the reminding your patients that never pulling back on that lifting skin, it can damage the fresh skin underneath. They can apply that post-peel protectant to that peeling skin to help that process move along, go wash their face, or use a small cuticle scissor to cut away skin that's hanging. Post-inflammatory hyperpigmentation is something that can exist within the VI pill portfolio if proper instructions are not followed. So if you know someone's prone to PIH, especially with the darker skin tones, again, always apply that solution to the outer edges of the face before applying it to the center of the face, and always be lighter with your application in the nasolabial, perioral, and marionette line area. And that PIH typically will occur in the skin after someone's picking at that peeling skin, or they've increased their body temperature. It also can come from below the surface and come to the surface after a peel, so that's also to prepare the patient for. And last but not least, PIH can be treated post-peel topically with lightening and brightening products included in our VI Derm skincare line, such as our vitamin C gel, our HQ Free, or our HQ Plus. And we'll talk about each of those items in a little bit. Here's an example of PIH that came up in a gentleman's skin, and we were able to remove the PIH within his skin. He had it in his bearded area, so it was most likely from ingrown hairs, and we were able to reverse that damage with using the VI Peel portfolio. Here's another example of someone who suffered from heavy PIH from acne scarring, and we were able to reverse the damage within her skin as well, and really were able to give her a clear complexion. Now we'll talk about acne within the peel portfolio. So acne-prone patients can definitely experience a breakout post-peel during the process of the peeling as well, and you always want to explain to them that this is positive as it's bringing oil and bacteria to the surface of the skin, and then we're going to actually be able to rid the skin of this acne dormant issue that exists. And then we'll always suggest people with acne to do a series of peels, and that's due to the fact that it'll come to the surface and then there may be some that's still dormant. So doing a series will help to really rid the skin of any acne issues. And then also we have a product called VI Derm Complete Care for Acne, and this formula is fantastic. It's a retinol formula that can actually be used post-peel or in between peels, and I suggest using about 10 to 14 days after the peel was applied, and that will help to minimize breakouts or kill any breakouts that have come to the surface after a peel. And the last thing we suggest with acne within the VI Peel portfolios is getting a cleansing facial in between peels if they're doing a series of peels. And that'll help to remove oil, bacteria, breakouts, blackheads, and also help prepare the skin for the next peel. And then we'll talk a bit about managing pigmentation and melasma. This seems to be a major issue with a lot of people, especially with the UV damage that can induce the melasma or hormones. So if a patient has hyperpigmentation or melasma, we always suggest a series of peels as well to be done sequentially, and this will help to treat the damage and help lift it. One peel, especially with someone that may have melasma, is not going to be sufficient in order to help reduce the melasma in the skin. You also want melasma patients and pigmentation patients to actually inhibit inflammation in their skin by avoiding and reducing exercise if they can for that full peeling process. That's 7 days, because heat induced in the skin can actually worsen the melasma and pigmentation issues. And then any patient with melasma, it's important to talk to them about the damage that may come to the surface. Because that pigment may be in various levels of the skin and lower levels, it's going to actually have to come to the surface and make it darker before it actually lifts and lightens. And for that, we have a lot of doctors that suggest using the VI Derm HQ Plus or HQ Free before they receive their first peel for a few weeks, and then start the peel series, or they can also just use it in between. And the reason we suggest our HQ Plus and HQ Free is it has pigment inhibitors in it, as well as has active properties that can lighten surface pigment damage, and we'll talk about that a little later on. Melasma also requires constant maintenance because it's a long-term skin condition. So a series of peels can definitely lighten and brighten that damage and improve your overall skin, but it's very important that anyone with melasma be on a long-term proper skincare regimen. And to do that, we definitely suggest a high-grade SPF like our VI Derm SPF 50+, to help protect the skin, but also have a product that may have an arbutin in it, like our HQ Free or HQ Plus, that will help prevent new pigmentation from forming on lower levels. This slide here is tips for patients, and a lot of practices actually print this slide out. So if you're interested in having this slide so that you can print it for your patients, please feel free to contact your rep, and they will be happy to send this slide over to you because I think it's important to give this to patients so they have it to take home with them. It instructs them to not exercise for 3 to 4 days, to drink lots of water to flush the chemicals through the system. No hot water should be applied to the area peeled for 7 days. Also, warm and cool water feels really nice on the skin. Cool feels fantastic while you're actually going through the peeling process. Always reminding the patient that when they apply the towelettes to be sure to not wipe over the lower eyelid area and to tuck in their lips so that the wipes do not touch their lips. Our wipes that they go home with, the towelettes, actually do have retinoic acid in them, so you want to be careful as to not shed the lip area. They'll wash their hands after the use of each towelette. And then for darker skin tones and pigmented skin, reminds them to use that post-peel protectant 10 minutes after each towelette has been applied to help prevent PIH in the skin. This shows them that they can use Aquaphor or coconut oil once the peeling has begun for dryness, sensitivity, any irritation. Any redness, chapping in the skin, we suggest the Aquaphor to help heal that with the irritation in the skin, and it'll also provide a protective barrier there to help with the healing process. Also, if you have patients that want to move their process along so that they're not peeling for a full 7 days, you could actually suggest they use the VI Derm Cleanser and wash their face more often and not over moisturize, because that'll help that process move along a bit faster. We suggest advising anyone who wears makeup, whether it be female or male patients, to clean their makeup brushes during that peeling process, because they're not really going to be wearing makeup day 3 to 5 or 6. So therefore, if they clean their brushes, they'll be able to put clean brushes on their new fresh skin. And then last but not least, tips for patients. If they're peeling their neck, décolleté, or any body part, that peeling is going to induce a little bit later than day 3. It may start around day 6 and go through day 10, actually. And then we'll talk quickly about some combination therapies that are available to do with the VI Peel portfolio. Microdermabrasion can be done the same day before the peel solution is applied to the skin. This will help remove any superficial layers from the skin and allow the peel solution to penetrate a bit deeper. Extractions can be done before applying the peel solution, but it can also cause sensitivity. And I don't suggest doing any deep extractions or any needling extractions because that could actually lead to PIH or blistering in the skin. So you don't want to do that. If anything, have the peel solution applied, allow them to go through the 7-day process, and do a cleansing facial maybe day 14 after the peeling process has been complete. So then you can do those deeper extractions that need to be done. And then with Botox and fillers, those can be done the same day. Fillers will be applied before the peel solution and Botox after. The Botox is great to do after as well because that numbing has kicked in, so you can actually go in and easily apply the Botox to the areas needed. Dermaplaning can also be done before the peel solution is applied, and this may cause a little bit of irritation as you're removing a lot of superficial layers of skin with dermaplaning, but as soon as that numbing kicks in after the first pass of solution on the skin, they will be okay. Hydrofacial can be done 7 days beforehand or 7 to 14 days after the peel is complete. I highly suggest after the peel is complete because you're going to get all those rich vitamins and nutrients from the hydrofacial being applied to fresh skin instead of applying it to the skin before the peel has actually taken place. IPL and LED can be done 2 weeks post-peel, and microneedling can be done about 4 weeks post-peel because you're opening up channels, and you don't want to do that on fresh, sensitive skin. You want to allow it to have time to breathe and adjust. And then marketing the VI Peel portfolio at your practice. People often ask us how we can go about doing this. You can offer a special on a series of peels. If they sign up for quarterly peels, they can receive a bit of a discount. Offering discounts with those combination therapies that we just discussed. Creating a special hashtag for your practice so that if people post to social media about being at your practice and receiving a VI Peel, they can get a percentage off. And always make sure that your patients are definitely hashtagging VI Peel as well because we repost, which will also help draw business to you all. And then send e-blasts to your patient list monthly. Our professional portfolio on our back end of our website allows you to have a full range of various e-blasts that you can just pop your practice's information to and send out to your client list. And then lastly, you can offer discounts on the VI Derm skincare products if your patients purchase them the same day. So that way after that 7-day peeling process, they'll have the proper skincare on hand to help extend and enhance their results. These are typical questions we get. If you have any questions at this time, please go ahead and feel free to put them. in the box on the right-hand side in either the chat box or the Q&A box, and I'll be happy to answer them, but I'll answer these quickly. How many times a year can a person have a VI peel? Safely every 4 to 6 weeks, but they can also do them for maintenance purposes seasonally. Why is someone not peeling? Is it normal? As I mentioned earlier, if someone's not peeling on the topical levels of the skin, it still is working on that cellular level of skin. And they also may not be peeling because they weren't degreased or cleansed properly, so you always want to make sure you're prepping the skin properly so that your patient will get the best effect of the peel solution. The best way to store peels is actually in a dark, cool cabinet area. And in the summer months at hot practices, in different states where it gets very, very warm, you can also keep them in a medical refrigerator. Next question is, when will I stop peeling? So someone typically has done the peeling process by day 7, and if you're doing body parts, it's usually between day 10 to day 14 that peeling will be complete. And how can the practice manage the expectations of their patients? We talked a lot in the beginning about the skin analysis, and I think that communication between the patient and the practitioner about what the patient's concerns are, what the practitioner sees, and having that discussion will really help manage the patient's expectations and what they're going to get out of the results. And then, can darker skin tones use the VI peel? Yes, safely darker skin tones can use the VI peel as long as you follow the things that we discussed about going around the outer edges of the face with a little bit more pressure and being lighter upon application of darker skin tones in the marionette line areas, the perioral areas, etc. Now we're going to go into the VI Derm skincare line, and we'll quickly move through each of the VI Derm skincares so that you guys can get an overall view of the line. We have our line broken down into various categories, including essentials, enhancement, treatment products, as well as body care products. We'll start with our essentials. And our VI Derm cleanser is one of our best-selling items. It's an aloe vera-based cleanser that is actually gel-based and foams up beautifully in the hands with just a little bit of water. It has azelaic acid built into it, as well as willow bark, and this will help with antibacterial effects within the skin, as well as lightly exfoliating and unclogging the pores. Because this product is aloe vera based, it is safe to use on a daily basis, multiple times a day. So you can use our cleanser to help remove cellular buildup in the skin, residue from makeup. It really helps remove makeup beautifully, as well as environmental stresses, and it's not going to strip the skin of its natural moisture due to the fact that its base is aloe vera. Our Daily Advanced Firming Lotion Moisturizer is an anti-aging moisturizer that has a lot of key active ingredients to help lift and firm the skin. It has a lot of antioxidants and hyaluronic acid built into it to help moisturize and soften the skin. Some of those key ingredients within this product include Matrixyl, which will work on firmness and elasticity, Oscilift, which is a tightening product that will actually help to firm and tighten the skin. It has a blend of different peptides, 8 different peptides. A hexapeptide 8 is a softener for the skin to help make the skin more supple and dewy. It has hyaluronic acid that will add moisture to the skin. And then it also has soluble collagen built in to help repair the skin. It's a beautiful daily anti-aging moisturizer. And then also in our essentials, we have our VI Derm SPF 50+ sunscreen. This provides UVA and UVB protection to the skin. It has 10% zinc oxide and 7.5% octinoxate. This VI Derm SPF is actually aloe vera based as well. So it doesn't leave a white chalky residue on the skin. It actually allows the SPF to seep down into the skin layers and help protect the skin and almost leave a nice glow to the skin as well. Green tea is also included within this formulation for our sunscreen, so you're getting antioxidant support as well while you're protecting your skin. Now we can move on to our enhancement products. And our enhancement products, we have our Intense Hydration Serum. This is a glycerin-based emollient that has citrus lemon stem cells in it. So you're getting plant stem cells that are going to go in and repair damage caused by environment and aging within the skin, as well as it's going to provide tons of antioxidants into the skin. It also has niacinamide built into this, so it'll improve skin barrier function. This is one of my favorite products, followed up by the next one we're going to discuss. So my favorite combination is to use this Intense Hydration Serum on the skin, and then cover it with the vitamin C gel. Our vitamin C gel is silicone-based, so it's going to leave a velvety, smooth texture on the skin, as well as fill in small fine lines and wrinkles. And it's a really, really beautiful product because it is not typical vitamin C that you'll get in the marketplace. It's next generation vitamin C called tetrahexadecyl. And this is an oil-soluble form of vitamin C that's going to be able to seep down into the lower levels of the skin better than your typical L-ascorbic acids that you get in serums in the marketplace. And the tetrahexadecyl also holds its efficacy longer over time than typical L-ascorbic acids. This really works beautifully on the skin just to help hydrate and give it a beautiful overall even tone, but it can also be used as a makeup primer. Most makeup primers are just built actually to go in and fill in fine lines with silicone. This actually has a silicone base, but with that tetrahexadecyl, you're actually going to be treating the skin and brightening and lightening the skin with anti-aging benefits while you're using it as a makeup primer. Makeup goes on beautifully on top of this. And last but not least, in our enhancements, we have our Revitalizing Eye Cream, the VI Derm Revitalizing Eye Cream. And this has many active ingredients that will work on various issues around the eye area. A lot of eye creams are heavy and dense, whereas ours is hyaluronic acid based, so I think of it as more of a serum in many ways because it has the ability to seep into the under eye area in that skin. It will actually take in the active ingredients quickly and allow them to be more effective. And those active ingredients include Esterol, which helps with puffiness and helps reduce that puffiness in the under eye area. It has Syncol, which is a form of collagen that will help reduce the wrinkles in the eye area. It has Helixal as well, which will help reduce pigmentation issues within the under eye area. And again, it definitely has that hyaluronic acid base, so it's going to add lots of moisture into the under eye area where we typically have dryness in the under eye area. Now we'll move into our treatment products. We have 3 different complete care products within our line of treatment products. This is our anti-aging product that will help you achieve healthier, younger looking skin, and it's our retinol line. So within this retinol line, we have 3 formulations, normal to dry, oily, and acne prone. All of the formulations have 0.05% retinol in them. They also have glycolic acid, and then green tea and coffee berry for anti-aging and antioxidant purposes. Our normal to dry formula includes 10% glycolic acid. Our oily skin formula goes up to 15% glycolic and also adds in 0.5% salicylic. And then our acne prone formula actually goes back down to that 10% glycolic, keeps the 0.5% salicylic, but it also adds in 5% BPO. This acne formula works fantastic for anyone who has active acne in the skin, but can also be used as a spot treatment to specific areas if you get monthly small breakouts. Our next product within the treatment line is our Ultra A, and this is our actual only pharmaceutical grade that has to be dispensed by a physician. It's 0.1% tretinoin, which is a form of retinoic acid. So this is our strong anti-aging, anti-pigmentation, and helps also with acne concerns in the skin. This will help rid the skin of aging issues, pigmentation issues, and help clear out acne conditions within the skin. The vitamin A is really going to be what goes in, is that 0.1% tretinoin, and really work to help strengthen the skin and exfoliate any damage. And it also has vitamin E and vitamin C built into it, so you're getting antioxidant support while you're treating the skin as well. And last but not least, in our treatment products, we actually have our VI Derm Clear HQ Free and our VI Derm HQ Plus. These products are complementary. The HQ Free is free of hydroquinone, so anyone who has concerns with using hydroquinone products or may have an allergy, this is a fantastic formula to help reduce pigmentation on the top layers of the skin, as well as work on evening out the overall skin tone. It has kojic acid and retinol to help reduce pigmentation and exfoliate off topical pigmentation. And it has arbutin, and arbutin is what helps inhibit pigmentation on the lower levels of skin from even forming. It stops the enzyme process of the tyrosinase from actually forming and turning into melanocytes, which then become melanin and come to the surface as pigmentation damage. That arbutin is going to stop that process from happening on the lower levels of the skin and help diminish pigmentation issues within your skin over long term. It also has licorice root and azelaic acid to help brighten the skin and exfoliate as well. Then we'll move into our HQ Plus formulation. This product just launched last year and it's doing fantastic, and we've gotten wonderful results all over the country and internationally as well with this product. And this is someone that's looking to help with pigmentation and overall issues with tone and texture in the skin. And it has 2% hydroquinone, which we know is the gold standard to reduce pigmentation issues in the skin. And with that 2% hydroquinone, we add in 3% Rumex, which also is known to help diminish pigmentation topically in the skin. And that Rumex is actually a botanical from Canada that actually has shown to be excellent at removing. So you're getting 3% Rumex and 2% hydroquinone that are going to work actively together to help lighten pigmentation topically. This formulation also has that arbutin in it, which helps inhibit pigmentation from forming on those lower levels, and kojic acid and licorice root as well. Those formulations are similar, but this one adds in that hydroquinone and Rumex so that you're getting a little bit more of a boost to helping lighten that topical damage. This solution, the VI Derm HQ Plus, is actually intended to be cycled on and off on a 4-month period of time. So if you're on the HQ Plus for 4 months, you can get off and go to the HQ Free for 2 months and then come back to the HQ Plus for 4 months to help with long-term pigmentation issues such as melasma in the skin. Now, last but not least, we'll move into our body care products. Our body care products are also complementary to one another. It's an exfoliating body wash and an exfoliating body lotion. Both have 15% glycolic acid. They're going to go in and help cleanse and work on exfoliating off dry skin as well as resurfacing and helping with any rough skin tone and texture issues. It can also help with pigmentation issues within the skin on the body parts as well. This also works fantastic for anyone with keratosis pilaris. It'll really help to diminish that, or any clogged hair follicle issues that they may have within their bodies. It also has vitamin C and vitamin E built into this formulation, so you are getting antioxidants, and it has provitamin B5. And that will help enhance moisture retention, especially when you're using a 15% glycolic. You really want something to help even out that moisture within the skin as we're drying it with a 15% glycolic. And our body wash, complementary to it, is we have the exfoliating body lotion. So the wash can be used in the shower, and then after you would want to use and follow up with the body lotion. We don't suggest using these products because of the high percentage of glycolic right after you've done any shaving or in any private areas. And we also suggest the use of our VI Derm SPF 50 Plus while using this product because it does have the ability to attract UV rays because you're using a glycolic acid. It'll make you photosensitive with the sun. Thank you all so much for attending today. I hope you've enjoyed this presentation. If you have any questions, again, feel free to put them on the right-hand side in the Q&A box or in the chat box, and I'd be happy to answer them right now. I have a question here. Yes, can the VI Derm Clear HQ Free be used prior to the peel? If not, when should it be discontinued? Yes, it can be used prior to the peel. Typically, if someone has normal skin, they can use it up until the day before they actually have the peel applied. If it's someone that has more sensitive skin, we suggest here as manufacturers that they stop it between 5 to 7 days before the peel solution is applied to the skin. But it is safe to use it up until the day before, typically, as long as the person has normal skin. Any other questions? I'll wait a minute or so to see if anything else comes in, but otherwise, thank you all so much again for attending today. All right, well, we're going to not have any other questions, so I'm going to go ahead and thank you all again one more time. Have a wonderful day, and please thank you for being a part of our webinar today.